Pneumothorax is more commonly known as a collapsed lung. The lung can fully or partially collapse. This collapse is caused by air leaking into the space between the lungs, the pleural space, and the lung itself. A variety of factors, including lung disease and trauma, can trigger this phenomenon. This condition can be life-threatening if not treated or if the collapse is severe enough. A pneumothorax can also be genetic, with 40% of those who inherit the gene for spontaneous pneumothoraxes having one themselves.
These are the statistics about pneumothorax. Pneumothorax is most common in males ages 10 to 30. That being said, about 7 to 18 out of 100,000 males get it each year, while females it is only about 1 to 6 out of 100,000. 91% of the people who have gotten pneumothorax are smokers.
A pneumothorax can only officially be diagnosed with an X-ray, but there are a variety of symptoms that can be observed and seen without one. Symptoms also differ depending on the severity of the lung collapse. The more common symptoms of a pneumothorax are chest pain and shortness of breath, oftentimes made worse by exercise. If the pneumothorax is severe, symptoms might also include fatigue, tachycardia, rapid heartbeat, and cyanosis, the skin turning blue from lack of oxygen.
When treating pneumothorax, the main goal is to release pressure from the lung and letting it re-expand. There can be many causes to this disease, so another goal could be to prevent it from happening again. Depending on your health and severity of the lung collapse damage, treatments can vary. Some of the most popular treatments include needle aspiration, chest tube insertion, non-surgical repair, or surgery. Each patient and their severity will vary from other patients. Understanding the disease and everything about it is the start to managing pneumothorax. Once you understand its history, making connections to what your diet should look like and such will make more sense. When you know the risk factors of it coming back, you can now know what to do and what not to do to decrease your chances of it reoccurring. The same goes for knowing the benefits and limitations of the numerous options of treatment. All in all, you can manage yourself in all aspects by having an understanding about everything about pneumothorax.
Many people who have had one pneumothorax can have another, typically occurring within 1 to 2 years of the first incident. A repeated pneumothorax without identification of the cause can be very serious and difficult to treat. Mild cases of pneumothorax may require monitoring by a doctor. These cases can include small pneumothorax or a spontaneous, also called primary pneumothorax. These can resolve themselves on their own. More severe cases can be life-threatening. These can include a secondary pneumothorax, one caused by a traumatic injury, or a larger pneumothorax, a larger pocket of air in the lungs. Tension pneumothorax is when air puts pressure on other internal structures like the heart and veins. This can be fatal if not identified and treated rapidly.
Pneumothorax is pretty much unpreventable. However, you can reduce the risk of getting it by not smoking. Once you are treated, you can reduce the risk of recurrence by not diving, stopping smoking, avoiding air travel for 1 week until full resolution has occurred, and lastly, by following up with a healthcare professional.